We have a lot of questions from our participants. So this question is coming from Dr. Naomi Esguerra for Dr. Montri. The question is, what are the possible risks and complications associated with the new 6th generation implants compared with older ones? And based on your experience regarding 6th generation implants, how can patients expect these implanted breasts to look over time, or after pregnancy or after breastfeeding?
Okay, to answer the first question, if I understand correct, you're asking for the risk or the complication compared with the new generation of the implants compared with the traditional or old generation of implants. Because the old generation of implant, we know that the pain point of the old generation of implant from the texture can cause minor inflammations inside the capsule that cause a late seroma. And even we use a smooth implant, so smooth implant can cause the capsule contexture easily more than the texture implant. So the new development of the Motiva or silk surface implant in between the rough and the smooth surface, similar the hybrid. Okay, smooth but not smooth, because the Motiva texture has the imprint technology to make the nano texture inside, so that prevent the capsule contexture, and second can prevent the infections that cause the seroma. So I think that the 6th generation of the implant is more benefit for now and in the future. Okay, I think I answer correct, clear for the first questions. And the second question, if I understand correct, you're going to ask the result from the new implants. When I compare the certification from patent in two groups between the old generation and the new generations, if I not biased, it means patent feel, first of all, okay, first thing they feel proud, and second the feeling, the movement, they say, okay, I think softer than before, because the shell of the gel technology make it more stretched and more flexible and stronger. Stronger means not easy to tear, so you can stretch the gel longer than the traditional implant, so that why when in the real life, when you touch or movement, when you squeeze the breast tissue, that means you can stretch the tissue together with the implant more soft and flexible, and movement of the implants are likely to more elastic. So it's move and then go back to the same positions. So the patent most satisfied from the benefit of this. So I explain to see the clear imagine. Okay, so I suggest, okay, to use this new implant, but not much different, much how to say, similar. You touch something softer and touch something natural, touch something traditional, depend on the feeling of the patient and the quality of the skin in the patient, very thin skin, less than pin thickness less than 2 centimeters. Something they can find the feeling of the breast implant inside more than the patient that have thick skin. So I think that this new generation may be benefit for the patient that have very thin skin, and they want to the shape and movement and prevent the rippling and whatever that I say before. Okay, the second question I answer clearly.
Okay, thank you for that, Dr. Kamonta. But I have a personal question. This is in relation to what you just said earlier about the new generation implants being more flexible and more elastic.
Yeah.
So my question is, I know this isn't, this is kind of funny, but it's practical. So my question is, how about your patients if they already have the implants in how often would you recommend having them squeezed? Because obviously, patients who get implants, who get their breasts done, would show them off. So what do you usually recommend about how often they should be touching their breasts, or how often would they get someone to squeeze their breast?
This depends on the carrier, her occupations. If the patient that have her job for showing her body, her exposure too much, I think they have a chance to get touched by other people. So this one, they touched by other people and feeling different. For the top class of this brand, the ergonomic gel is more rheologic, more flexible than the silk surface model. So if talking about the top model of this brand, ergonomic, the gel is more flexible than less hard and more elastic and more softer. Feel like the natural movement is different from the old generation implants.
Okay, so maybe we will just ask our patients if they actually ask somebody else to squeeze their breast.
Ask her husband or ask the other people or friends. That's okay.
So another question for Dr. Montri. Doctor, how would you advise patients who request for larger implants than the recommended size? That question coming from Dr. Eden J. Dilemos from Iscal.
The question is asked about the size, right? The size of implants.
Because sometimes always ask for the bigger size rather than the recommended size.
Nowadays in Thailand, now they change to insert the small implant to be natural. But the patients that are looking for her carrier that they want to show or explore her body, they still ask for the big size of the implants. Normally, when the patient asks for the big size of implants, I suggest and tell the patient the truth about the long-term, the complications, such as the thin skin or oversize to the lateral and skin more totic quickly and resolve from the pressure, pain or more tensions on her chest wall. So can put insert, but have to consent by the patient before doing the operation to save the doctors. So now I measure the breast width tissue before. If the breast width tissue small or large, I tell the patient the truth. Implant should within the inside of the breast parenchyma or the breast tissue to cover the implant all the times. If they don't understand, I tell them the truth about, for example, her nose. Most of Thailand, they put silicone inside the nose. If something bigger like the silicone insert to the nose is will obvious in the long term, make the thin skin or protrusion from the protection. That's the same reason I tell the patients and patient, easy to understand, doctor tell me the truth. So if they want, the bigger size of the breast or even the nose, that's the same effect. And if they accept, that's okay. I can operate with her. So I tell the patient like this. Okay.
Yeah, that's true, doctor, because as doctors, we should know better. So we should be the ones to make the appropriate decision and then explain to our patients what's best for them.
Yeah.
So I think this is for Dr. Camonta from Dr. Veronica Nazarenko. Do you use any antibiotics or anything else for the pocket?
I think I show in the video already. I use a triple antibiotic. Number one, betadine solutions. I use about 500 cc plus with 1 gram of the cefazolin antibiotic. And the third, I use the gentamicin 1 ampoule mixed together before I irrigate inside the pocket. Okay. And then wash out with the normal saline.
Thank you for that, Doctor. I think that answers Dr. Veronica Nazarenko's question. She also asked including the rate of dilution. So anyway, you already answered that question. So do we have any other questions for our lecturers, Dr. Camonta and Dr. Acosta? Okay, so again, thank you to Dr. Camonta and Dr. Acosta for a very informative and very detailed lecture. So thank you for sharing your extensive knowledge on your respective topics.
My pleasure po. Thank you for inviting me.
Absolutely right, indeed. Before anything else, again, I want to remind all of our viewers that if you have any more questions, kindly do email it at paas30convention@paas30convention@gmail.com, and we will be getting back to you for that.